The 2022 election is so close. We're just counting a week or so, and we'll have a new president, new leaders in this country. So I thought when the new man, because the president candidates are male, when the new man comes to office, and I got a chance to meet him as Dr. BMS, what will I tell him? What would I like to tell him? I'll tell him, Mr. President, our health system is sick and you need to do something about it. I'll tell him, overhaul the health system. Do not do a patchwork like your predecessors have done. This is what I would like to talk about today in Dr. BMS. But before I delve deeper into it, I want to ask you, my listener, have you subscribed to Dr. BMS channel? If you haven't, please go ahead and subscribe right now. By scrolling down on the right hand side of your screen, you will see this red button written subscribe. Click on it, it will turn gray and read subscribed. Then you'll know you'll have subscribed. It's free. It just makes you join the community. You get notification when we make these videos and we talk about our health as a society, as a people, the health of our bodies, our mind, our soul, and our community. So, Mr. Incoming President, please overhaul our health system because it is sick, it is archaic, it is not serving the interests of Kenyans like it is supposed to be. And the dream of health for all, which was by the year 2000, now we are in 2022, health for all maybe by the year 3000 may not be realized. But we can turn around our fortunes if we do some of these things that I would like to suggest and other scholars have suggested. So, Mr. President, our health system right now is a mix of publicly funded and privately funded. So people seeking health services in Kenya will go into a health facility, that is a curative. They go into a health facility and it's either government facility or a private, and sometimes we have those faith-based institutions which are a mix between the public and the private. And when they get there, they find this health institution, it could be a dispensary at the lowest level, a health center at the next level, sub-district, district hospital, now they are called sub-county, county hospitals, and extra county and national. So they are graded at levels from the smallest, the lowest, to the highest. And in each of these levels, our planners have tried to fix all the services that they can get in there. So if you go to a dispensary, you can have a little surgical operation. Maybe you've had a cut, you can get a stitching. If you have a fever, you have a cough, you can get treated for pneumonia or cough. If a mother is expectant, then they can have the basic antenatal care given to them. If an old person has got blood sugar problem, blood pressure problem, they can have it checked and maybe some medication given. So we have a health system where all the services are packaged in one place and graded by levels according to the sophistication that is available. I am of the opinion that this system is archaic, and I'll talk about it in a short while. Before I forget, also when you go to these levels that I've described, you will be given free, in quotes, services. That means you don't have to pay money, but the taxpayer, we Kenyans pay our taxes, so the government funds such facilities. So you go to a facility and maybe maternity services are free. Some of these facilities are in the same facility, you may be charged for other services but not others. So you pay. And this payment can be directly from your wallet, from your pocket, what we call out-of-pocket payments. And sometimes it can be by insurance. So the health system is a mix of public, private, funded out of the pocket, funded by insurance, and sometimes funded by the public tax. This is a system we have inherited from the colonial administration, and we have carried on up to date. I'm proposing that we overhaul this system. We do not do away with it, but we overhaul, we shake it up so that it conforms to the needs of the 21st century that we are living in. In my previous video, I said that the candidates who are offering themselves for election, Wajakoya, as presidential candidates, Wajakoya, Bishop Mwaure, Baba, Hasla, I said that none of them seems to get the grasp of the problem. They are all vague. Some are prescriptive, some are just glossing over issues, and some are sensational but lacking in substance. They have all come now. They have given us their manifestos we've read. They have even come for debates. Some skipped debates, but that's okay. They talk to us in other ways. We know what they want to do. And from the analysis of what they have presented to us, I would say they are still vague. They do not have the comprehensive view of our health system, what ails it. And this is what I would like to talk about. So when I talked about the 6 pillars of good healthcare in my last video, if you may remember, I talked about things like health financing. I talked about things like the health workforce. I talked about essential supplies. I talked about the health service delivery. I talked about health ICT. So these pillars remain relevant now, and it is with this in mind that our incoming leaders should overhaul our health system so that we focus on the pillars of health but adapted to the needs of us as Kenyans. So in Dr. BMS' idea for an overhauled system of health, I'm looking at thinking out of the box, throwing out the old rule book. Just like in the education system, we've had the 844 system has been discarded, and now we have got the CBC. This is what I'm talking about. So we need to come up with a new system, but still focusing on the 6 pillars, or the pillars of health. If there will be more than 6, I'm happy to have them, but the pillars of health. Now, if I just take you through a few of them that I think are in dire need of an overhaul and can form a basis of the new overhauled health system as prescribed by Dr. BMS. We've had our candidates, presidential candidates, talking about health financing, and all of them talk about NHIF. They say we are going to lower the premiums we pay to NHIF. We are going to have coverage for everyone. There is a universal health system where they say everyone will access health, but it will be affordable, perhaps even free. This is okay, but have we thought about it this way? That the NHIF, the way it is it serving our needs maximally? I would say yes, but it can be done another way. It can be made better. What if, for example, we split NHIF into 2? We have NHIF Junior for the young population, let's say 20 years and below, and NHIF Seniors for, say, above 20. Why Would this be a good idea in my opinion? When we look at the disease pattern of Kenyans, we see that most of the people who come to hospital are tied to particular diseases which can then be grouped according to ages. People who are young, they will come into hospital with infections, coughs, fevers. They will come into hospitals with little injuries. And if you compare to the older generation, they will come in with lifestyle diseases, blood pressure problem, blood sugar problem, cancer, arthritis. So when we look at the disease patterns, what we call the morbidity patterns in technical terms, we see that morbidities that are of the younger generation center around infections and little problems that can be solved at once, and people go home and get okay. You come in with malaria, you are treated and you're okay. As opposed to the older generation who come in with morbidities or diseases that tend to stay for a long time. You have cancer, you stay with it until it kills you, or maybe if you recover many years later. You have diabetes, you have asthma, you have hypertension, it lasts forever. So when you look at it, these people accessing NHIF, you will see there's a difference in how much demand they place onto the system. If we were to split NHIF into the juniors and the seniors, we would have the junior NHIF, for example, spending less money because most of the diseases that the juniors come with are not complicated. They don't last long. So while they are contributing, or their families are contributing, the demand on NHIF is less. This would allow this fund to grow. The fund can grow through the market systems that exist, so that by the time someone transitions into the seniors NHIF, if they joined at the juniors, they have saved, and their investment, their saving has been invested and accrued, so that the big diseases coming in old age, they are better placed as NHIF, and as individuals, their accounts are better placed to cater for them. For the seniors NHIF, after we have split, we can then channel more subsidies from government, from employers, so that when these seniors are draining this NHIF more than the juniors, we are injecting in that subsidy to cushion the NHIF against excessive demand for financing. This will be better than where we have now one NHIF, and we assume everyone goes there that it will solve their problem, but perhaps it's not well placed to solve, because one section of the populace is draining it more than the other without us realizing about this. And still talking about this pillar of financing, in my overhaul health system, Mr. New President, I would recommend that you incentivize, you come up with legislation, encourage more incentivization of, for example, employers contributing into NHIF and getting some tax breaks as a return. There was this legislation which was in Parliament sometime that employers contribute a same amount, same ratio, 50-50 with, or 100% with the employees, but it didn't see the light of the day. Perhaps if this was started on a voluntary basis with incentives provided, we may get employers coming on board and creating a momentum which later on will make it more or less a universal rule, and it can go into legislation, so that we have more funding of NHIF, our insurance scheme, by the employers than it is now. Also, on the pillar of health supplies, which also touches with financing, Mr. New President, I would recommend that you incentivize again the local manufacturers of the commodities that we need in our health system based on our morbidities and disease patterns. So, for example, the young population, I said, would come in with infections more than other things. And these infections can be treated by simple generic drugs. We can incentivize our local manufacturing industries to produce these generics. This technology can be acquired if effort is put to finance the acquisition of these. Plants can be set up. The ones that are there can be expanded so that we do not have to get drugs imported from outside the country, which sometimes causes breakages in the supply chain, and this causes problems with supply of medicine. We've had the KEMSA scandal in the last government. Part of this problem was that KEMSA was supposed to get supplies from outside the country, and people have given tenders to supply KEMSA. If some of these things, if all of them in fact were being procured from here, it would be easier for KEMSA to directly deal with the manufacturers and get these things supplied. I know some of them are not able to produce them at the moment. We don't have the technology. But most of the basic ones, the antibiotics, the painkillers, the cough syrups, which will cater for most of the morbidities we see in our young people. We can do this. So, Mr. Incoming President, that is food for thought. I think also that we can shake up the health delivery system we have. As a pillar of the health system, I said we have got the levels: dispensary, health center, sub-district or sub-county. So they are called the CAF levels 1, 2, 3, 4, 6. You may have seen as you pass and you hear level 6 hospital, Kenyatta National Hospital. Level 5 hospital, Machakos County Hospital, level 5. These are levels that are based on the quantity and the degree of services that are available at each level. But as I said, all these levels have this philosophy of putting everything they have packaged in one place. This is one area that I would recommend a shake-up, Mr. Incoming President. What if we design our CAF levels to be guided by our disease patterns, our morbidity patterns? And these morbidity patterns be regional, be local. Because the health function has been devolved to the counties. If you take a county, like I come from Kakamega, for example. So Kakamega County, the health planners there will look at the disease patterns and say, in this county, we've got diseases A, B, C, D, and this age group from birth to 5 years have more of this than the next age group, like that. So as they stratify the population against the disease patterns, then they can also get the geographical locations where these diseases are prevalent and link them up to population maps, so that these CAF levels now become CAF levels that not only serve the various needs at graded levels, but specific needs to an area. So if we have a sub-county, for example, which has got high morbidity of under 5, and this is mainly infections, malaria, pneumonia, the county government can purposefully convert a health facility that exists in that area, a health center or sub-county, or even build purpose one for that, which is for those diseases. And they can get the best personnel, the best expertise, equipment. They can get drugs delivered in this facility. And you will find the consumption of services in that area will increase, in that facility will increase, because the facility is tailored to the morbidity, the disease needs of that population. This to me is better than just having a blanket classical approach where we say level 1 is going to have these services, level 2 these services, and you find a level 1 hospital or level 4 hospital in a facility, you have one area that is not used. Maternity services are not being used in this area, while in another area, women are delivering even on the floor because the wards are full. We can disaggregate and link up these cave levels with the morbidity patterns that we see. Also, in this proposed overhaul of our health system, Mr. Incoming President, I would suggest that we focus and refocus more on prevention medicine, promotive medicine, than just a curative. Let us not just think of health as hospitals and health centers, as medicines and injections. No. Health starts with you, an individual, what you do at home, what you eat, how you live, and transitions later to if you get sick and seek health services. I read the manifesto of Jakoya, and although I said in a previous video he was sensational about some things, but he mentioned nutrition, which is good. We need to focus more on promotive, preventive health services. This means that immunization can be expanded, scaled up. We have the KEPI, the expanded program on immunization. We can expand it even more. New diseases are coming up. We are battling corona now. We've got new vaccines coming into production, and some of them are helpful in preventing diseases. They prevent cancers, they prevent infections. We should invest our resources in having these vaccines available as part of the expanded immunization program and as part of the prevention measures that we need to do. I proposing that we link more our public health, our preventive, promotive health system with our school system. We link up our mental health system, which I'll talk a little bit more in a short while, but we link it up strongly with our health system in the promotive, preventive aspect with the education system, so that our learners, as they start in primary school and progress, they get education about health. Health becomes a subject like biology, like mathematics, like CRE. We can teach sanitation, we can teach disease prevention, we can teach mental health diagnosis, psychological first aid, so that people are aware of these things before they develop and they know what to do if they get into those problems. I've said mental health needs a special mention. It's becoming a big problem in our country. When Wajakoya says that he's going to legalize marijuana, we worry about mental health. Mental health is big. It is estimated that a big proportion, probably up to 40%, 4 out of 10 Kenyans have got mental health problem. So, Mr. Incoming President, this issue of mental health should be made big. It should be made to stand out and not be enmeshed in other aspects of mental health like it is today. People need to know that when they have mental health problems, they can seek services the way they can seek when they have physical health problems. At the Fountain of Hope Treatment Center, where I'm talking from right now, we deal with mental health, with rehabilitation, and the financing into this is low. NHIF allocation is the lowest you can ever get. Most of the private insurances do not even give it. The stigma out there is too big, and government needs to come in with a real plan, a Marshall Plan, to elevate these mental health problems that Kenyans are facing and which sometimes transition to become physical health problems. all said and done, the overhaul that we will need in the health system requires that commitment, that resolve in our incoming leadership that health is as important as other things. We've had in the recent past in this country more focus, in my opinion, more talk about infrastructure, roads, physical infrastructure. That is fine. I support it. But my view is that we create a healthy balance between these varying needs that we face as Kenyans, and one of the top on that list should be health. So, Mr. Incoming President, be it Baba, be it Wajakoya, be it Bishop Maure, be it the hustler in chief, think of overhauling the health system and not just continuing the patchwork that has been done in the past. See you again, my dear viewers, in another video of Dr. BMS, and I wish you a peaceful election, happy voting, and good health going into the new government and the new future.